Thank you so much, Mr. Rivera. And with that beautiful intro, I now would like to turn it over to our Master of Ceremony, Mr. Abdul Muhammad.
All right. Thank you. I mean, wow. I was on the planning committee, and that definitely wasn't a part of anything that we talked about. So that really caught me off guard, and I really do appreciate it. But I don't want to belabor the point and talk about me anymore. I want to get into this fatherhood conference because we're here today to be able to learn and grow and be able to help fathers. So let's move the conference along so that we can get some things going. So we're going to start off with some opening remarks. Our first person is Dr. ZULMA TORO. She is the president of Central Connecticut State University. Let me read a little bit of her bio, and then we'll get going with her opening remarks. Dr. ZULMA R. TORO began her tenure at Central Connecticut State University in January 2017. Her presidency marks 2 milestones for CCSU. She is the university's first female president and its first Hispanic chief executive. She continues to boldly lead CCSU and prepare the university to exist as a model of exceptional 21st century institution of higher education. Please join me in welcoming Dr. ZULMA TORO.
Good morning, everyone. And thank you for joining us for the 7th annual That's Matter to Fatherhood Conference. Though we are meeting virtually once again, I know the level of engagement and interest among our panelists and guests is as vibrant as ever. Driving that engagement is the Brotherhood Initiative at Central Connecticut State University, which is dedicated to the health, retention, and graduation of Central's male students. I thank the students, faculty, and administrators who work on behalf of the initiative and its Healthy Fellows campaign for convening this important conference and for creating a space for important conversations about fatherhood to continue. This type of engagement is vital to our university mission. At Central, we work every day to cultivate a community of respect, responsibility, and compassion, and we expect our students to demonstrate these values on campus and in our communities. These sensibilities are as critical to a students' development as their academic pursuits, and Central's faculty and staff take great pride in encouraging healthy discourse and behaviors. Along the way, we see our students become compassionate leaders and respectful citizens year after year. Naturally, many of them also become parents, and though children still don't come with instructions, we do know that knowledge is power and support can make or break a relationship. That, to me, is why this conference and the work of its partner organizations is so necessary and admirable. We all know there is a lot of work left to be done in addressing the social factors that affect the life of boys and men. But as you share your expertise with each other today, please remember that with every year this conference continues, we expand the support network and education resources available to Connecticut's fathers. Your work affects thousands of individuals, and I applaud your effort to support families and by extension, make our state a happier and healthy place to live. I know you have a busy and exciting day ahead. So thank you once again for joining us, and I hope you have a very much nice day and enjoyable conference. Thank you.
Thank you, Dr. Toro. Next up, we have the DCF Deputy Commissioner, Mr. Michael Williams. Let me share a little bit about Mr. Williams. Deputy Commissioner of Operations, Michael C. Williams, with over 25 years of progressive leadership in the child welfare and behavioral health services. Michael C. Williams brings a unique mixture of internal and external knowledge and experience. He is a graduate of Northeast Louisiana University of Monroe, University of Connecticut School of Social Work, Trinity College of Vermont, and the University of Connecticut School of Business Executive Program and Managed Care. Please join me in welcoming Deputy Commissioner Michael C. Williams.
Hello and good morning. Good morning. Are you able to see me?
Yes, sir.
Okay, I wasn't sure. Can't see myself actually. Okay, there. Thanks. And good morning to all who are a part of this annual critically important conversation that we're having about fathers. Let me first begin by congratulating you, Brother Abdul, on a very well-deserved moment of dedication to the works that you've done in this community around many different things. Clearly, you have become a monument in this area, but we know it didn't start with you. Those of us who knew you before you knew yourself. we know Abdul Sr., your dad, who was just as a giant in stature and in reputation, and it's clear to us when you got good dads create other good dads. And so that's a clear example of that. And so congratulations to you, man, and keep up the good work and the good things that you're doing in the community. People do acknowledge it, and people do appreciate what you're doing if you hadn't heard it or felt that from folks. Again, we come to this time of the year to have this annual conversation related to fathers and the role of fathers in not just our services that we have, but in society as a whole. And growing up in Louisiana, it's one thing I always knew and firmly believed, and that is that children do better when they grow up in families, and families are great when they're strengthened by communities. And so with that as a belief system, the strength of a community is not just on the backs of one gender of adults, but it's both gender of adults. And dads are critically important, and men are critically important to the strengthening of communities. And sometimes I think we forget that, particularly as it relates to family and family strengthening, that the power of a male relationship to a child is so significant that it has the ability to cause, that family unit to rise from, situations that have been challenging them for quite some times. Needless to say, we have to do better, and we have been doing better as a state agency to assure that wherever we can bring in fathers, not just fathers, but men who are raising children, bring them into every aspect of the work that we do. Not to be on the sideline, not to be an afterthought, but to be upfront and centered in the planning, discussions, and all the work that we do when it comes to supporting and strengthening families. We've shifted our role in the department, as many of you have witnessed over the past 10 years, to really be about the community and to go and build positive relationships so that we can contribute to the strengthening of communities. We can invest in areas that will prevent families from even needing a report made on them to us, or having our services be a part of their lives. We know that it's threatening and intimidating at times to have a DCF person knock on your door, and we don't want that to happen for families. We want families to be healthy and strong so that those occurrences don't happen. But we do, and we also know that the way, one path we can do that is by assuring that families and communities recognize the strength of dads and fathers in the whole equation. And so I'm always excited when we have these conferences, we have these conversations. And for those of us at DCF, they know that not only am I excited about these types of events we have, but I look critically at what will this event do by way of improving our outcomes and our results in our work. That's where the rubber meets the road, because obviously we're going to hear some great stuff today. Obviously, there's going to be a lot of inspiring stories and light bulbs going off about how great it is to do fatherhood work, but it can't stop here. I mean, it has to then translate into our day-to-day activities, our day-to-day encounters, every dad, every day, every family, to assure that we implement these great ideas that we're hearing on today. And so I'm excited to see what's going to come out of today's conference. I know Jennifer Rendini and Jeff Gold and Steve Smith and Anthony Gay. I'm going to get in trouble for calling all these names because I know I'm going to miss some. But those who've been working on this to get us to this point, I know they did it thoughtfully and carefully to assure that they looked at the way in which we do business and want to kind of thread the needle and give us those presentations that will help us do our work that much better, so families and children are better off due to our intervention. So I appreciate it. And again, good to see you, Abdul. Great to see you in good health, and look forward to this conversation that is about to happen today. Thank you.
Thank you. I want to get our last introduction so we can be able to move into the work that we have today. So our last opening remarks that we have today are from the Commissioner of the Department of Social Services and Senior Advisor to the Governor for Health and Human Services, Dr. Deidre Gifford. Dr. Deidre Gifford was appointed by Governor Ned Lamont to lead the Department of Social Services in June 2019 after executive service with the Federal Center of Medicaid and CHIP Services and experience in medical practice, the nonprofit sector, and government health services in Rhode Island. Please join us in welcoming Dr. Deidre Gifford to welcome us this morning with some opening remarks.
Good morning. Thank you very much. My name is Deidre Gifford, and I'm, as you just heard, the Commissioner of the Department of Social Services, and very honored to be the co-chair of the Connecticut Fatherhood Initiative Council. Thank you, Anthony, for your opening remarks, to Matthew and Jen for your work. Thank you to CCSU and Dr. Toro for your support of the initiative over the years and for being virtual and actual hosts. Thank you to Tony and Diana at DSS for all of their hard work on the conference and throughout the year. And congratulations, Mr. Muhammad, and thank you very much for your inspirational work. It's really my pleasure to be here with all of you this morning. I'd also like to thank especially my partner and collaborator, Commissioner Vanessa Durantis at the Department of Children and Families, and Deputy Commissioners Williams and Hill Lilly for their commitment to this initiative, their leadership in supporting boys and men that are involved with their department, and for their unending willingness to collaborate on all things fatherhood. Thanks to you for being such great partners. I'd also like to thank someone you'll hear from tomorrow, my Fatherhood Initiative Council co-chair, Senator Marilyn Moore, who's a great supporter of this work, and all the members of the council for their continued dedication to the various areas of this really critical work that you've been hearing about already this morning. I'm honored to speak just for a very few minutes for you this morning about the efforts of the Connecticut Fatherhood Initiative and what we've been working on since last year's event. As you heard, I think from Anthony, that we didn't let the team working on this didn't let the pandemic bring things to a halt. It changed the way we did our work, but the work has continued. Some of you may know, but just for background, the Connecticut Fatherhood Initiative is in the Department of Social Services, which we serve as the lead agency, but it is a statewide collaborative effort, and it includes a number of state agencies and local partners. The CFI, Connecticut Fatherhood Initiative, began with the passage of legislation back in 1999. So our partners and the departments have been working together for over 2 decades now to really work to change systems and create policy and practice to better support the families and fathers that we serve. We came together in the fatherhood work as representatives from state and local agencies, as advocates, as policymakers, and we aspire to support fathers in all of our work. Many of us, of course, are also mothers and fathers, sons and daughters, who have our own lived experiences when it comes to fatherhood. Some of the stories are positive, some may be not so positive, but we know here in Connecticut and across the country and the rest of the world that there are countless fathers doing their best every day to strengthen and shape their family legacy by teaching, loving, and inspiring their children. And I know that's what this conference is all about. It's our responsibility as professionals who serve families in the state of Connecticut to make sure we are serving the whole family, whatever it looks like. CFI partners have long recognized that fathers, even when they may not live in the same homes as their children full-time, look a lot like the mothers who do live with the children full-time in their need to access services through our systems. They have similar social service, educational, and employment needs. And that's really an important foundational principle for the work of the CFI. Although DSS is the lead agency in the initiative, we don't own it. We are all needed to ensure the success of supporting fathers and children, co-parents, significant others, and significant and extended family members. Since last year's event, the CFI partners have been busy implementing our strategic plan, which is an important document and roadmap for the work of the initiative. It includes recommendations for short and long-term strategies to address programs, policies, system barriers, and expand promising practices that are already being implemented, and establish new and strengthen existing partnerships at the state and local level. The initiative has several committees that focus on areas such as fathers' economic stability, healthy relationships, criminal justice system involvement, policy change and data development, and the special needs of populations like young fathers. All of our work is done through a racial equity lens and a focus on safe engagement. All of the five committees have representation from numerous state and local agencies relevant to the domain focus and continue to meet regularly to move the work forward. One of the most fruitful results of the implementation and strategic plan thus far, beyond rejuvenating those of us who've been at the table over the years, is the new partnerships that have been formed under each of the domains at the council table. So I want to take this moment to say thank you to all of you who've been engaged with the CFI since its inception, and welcome any new partners at all of our tables, as we need you more than ever in this work. Before I close, I'll just share a couple of examples of the CFI's most recent collaborative efforts. First, on a national level, CFI was one of 3 organizations nationwide invited to participate in a video project produced by the Kresge Foundation and the Aspen Institute as part of Kresge's Human Services Program's efforts to deepen their investment in fathers for whole family prosperity. Kresge's leadership engaged the Hatcher Group to produce a handful of videos that underscore the importance of fathers for whole family well-being and to highlight work in this space, and asked for the Aspen Institute to coordinate the project. The title of the video, for which CFI, is called Flipping the Narrative Script. The 7-minute video addresses outdated or traditional family and gender role narratives and storytelling to leverage the power of fathers for child and family well-being and progress in the ways we support fathers for better child and family outcomes. Also, on the local level, CFI is currently running a pilot in Hartford. It's funded through COVID-19 dollars and as a result of the pandemic's effects on employment services through DSS. And with our partners in judicial support enforcement services, the Family Support Magistrate Division, and the Department of Labor. With the closure of some of our offices and courts and the American Job Centers when the pandemic hit, non-custodial parents weren't always able to avail themselves of new referral processes from child support court directly to American Job Center staff. So the non-custodial parent employment pilot is a partnership between these partners, as well as the DSS Department of Office of Community Services. Knowing the pandemic created greater service gaps in this pilot program goes beyond the referral process to ensure focused one-on-one support through case managers to help parents achieve employment goals and better meet their child support obligations. These are two of just the many efforts in which CFI partners are involved. The committees, the council, and our numerous state and local partners serving families are always continuing to explore ways to identify opportunities for systems change to support fathers, mothers, and children across the state. I want to thank you so much for your participation in this conference, which is, of course, another great example of the CFI partners working together to inform, to inspire, and to support the work you all do for fathers and for families. I wish you a great conference, and thank you so much for the opportunity to speak with you this morning.